fellow panelists on the dais, Mr. Upendrajit Singh, Dr. Sabarwal, Dr. Satpathy, and Mr. McBrien. Esteemed delegates, the distinguished resource persons, the ladies and gentlemen present, I must thank Elets for giving me this opportunity to stand in front of you and share my few thoughts on this topic. I'm a doctor. I'm into the healthcare for almost last 45 years. Was setting up two super specialty hospital in the state of Assam, running for almost more than 3 decades. But at the end of it, I have realized that private healthcare is becoming more and more expensive every day. It's beyond the reach of almost 70 to 80% of the people in this country. We know that recent socio-economic survey published by the government of India says that 70% of the people in this country, the monthly household income is below 7,000 rupees. So you can imagine what they will do when there is a need for healthcare, especially secondary and tertiary care. So as a result, this 75 to 80% of the people do not have any alternative but to the public hospitals for their healthcare needs. As a result, public hospitals are overcrowded. If a doctor can attend to 20 patients, there will be 200 people waiting in front of him to be seen. So they are tremendously under pressure. There is impossible to deliver quality. Private healthcare, I am one of them, has failed, I would say, as a private healthcare provider. We are one of the service providers in this world who have failed to innovate. As a result, our prices keep rising every day. Look at telecommunication. It was started 20 years ago. A distant call which costed 12 rupees at the beginning now costs us only 1 rupees. But in healthcare, everything keeps rising in 100% year-on-year basis. But the people's income do not increase. As a result, we set up shops and look for patients abroad, whereas millions of people in this country are dying for want of healthcare. Do we think that is it only the responsibility to government to take care of them? Are we supposed to do only business with the rich who can afford to pay you? Who takes care of this 80% of the people if we do not? Why people should respect us? The things that we are running and doing in this country as a private healthcare operator cannot be a solution to the healthcare problem of this nation. It can't be a business model. I would rather say, please forgive me, I am also a private healthcare operator. As a result, I thought, could there be a solution where we can manage quality, bring down cost? Not an easy job. Many people have tried it across the globe, but there was no answer. We have failed. So what I did, I went back to the community. It's a problem of the people. With my own experience of last 45 years, let me go back to the community, relook at the problem with a different perspective, understand what their problem is, what kind of technology they need, what kind of doctors they need, what kind of money they can spend, not what is available in the market at a particular day. I must look at the pocket of my customers. If I want to be in business, if I want to make a shirt for them, I must make a shirt which fits into their body, which they can buy with the money that they have in the pocket, not what I can produce at particular price. So with that intention in mind, we had a very humble experiment in the state of Assam. We innovated, a lot of innovation went on, starting from planning, designing, structuring the building without compromising on quality and patient safety. And as a result, a tertiary health hospital, which cost an investment of around 50 lakhs per bed, we could do it at 25 lakhs per bed. A greenfield project, this is a green building. This is a green building. A greenfield hospital requires around 3 years of implementation time. Assam has got a lot of problem with floods, rains and all. In spite of that, we completed this project in 20 months' time. Not only that, we have seen that this is not healthcare industry that we are working on. This is a sick care industry. You become sick, I treat you, and that's my business. Very simply. No emphasis on preventive and promotive care, especially by the private sector. We think that this is the job of the government. They should do prevention and promotion of health. But the joy of healthcare is preventing sickness and promoting health, not wait for them to become sick and do business. So in this model, what we have done, 500 people work in the hospital, another 500 work in the community. Who becomes responsible for health of the community? They create awareness, they work for preventive and promotive health of the community. That's one. A private hospital, it has to be sustainable, but an equal number of people works in the community for promoting and preventive health and creating awareness amongst the people. Number two, accessibility is a big issue in a hospital, especially tertiary care. We are not able to create tertiary care hospital everywhere and anywhere. Most of them are situated in metropolitan cities, and some of them are going into the Tier 1 and Tier 2 cities, but not everywhere. On an average for a tertiary care facilities, a patient has to travel almost 50 to 75, sometimes up to more than 100 kilometer distance. And the work process, the protocolization in public hospitals are such that I have done that study in Assam, Guwahati Medical College, where I was also working some time ago. I am an alumni of All India Institute of Medical Science. I still go there and see the work process in All India Institute. I study the work process in almost all best of the hospitals in the world across the globe. I have seen that on an average, a person needs to come make 6 visits to complete an OPD procedure. First day he comes and sees the doctor. Then doctor will give him a series of investigation. All these investigation cannot be done in one day. If blood on another day, radiology another day, ECG another day, like that, 4 or 5 visits. Then on 6th visit he comes, collect the reports and go to the doctor. What's the economics of having 6 visits to a hospital from an average distance of 50 kilometers? Along with an escort, if you calculate the economics, each visit does not cost him less than 500 rupees, even by public transport. And that cost him 2,500 to 3,000 rupees only for going and coming. Plus, these 2 persons are not working for the last 6 days. He's just coming and going from the hospital. He must do something every day, otherwise he does not have anything to eat and fall back upon. 12 man days loss. How much does it cause a loss to him economically? Another 2,500 rupees. So the public healthcare system that we are creating in this country, we are not able to improve upon them. I have seen it for the last 45 years. So he loses 4,000 to 5,000 rupees simply in going and coming to the hospital. Even if we make it free, he spends 5,000. Even a person below poverty line is not spared of that. This money is more important for him. He cannot get public transport free just because he has a BPL card. Nobody will give him money just because he could not go to his work and he had to come to the hospital. So, this is what the healthcare is in this country. And in this process, what we have done, we are also creating a network of public transport services between the community and the hospital. And this patient can avail these transport services free of charge. We don't charge them. They come by this transport, they go back to their community by this transport. And when a patient comes, up till now in this model, we do not charge registration fees, we do not charge consultation fees, whether he goes to a medicine specialist or to a neurologist or a cardiologist up till now. He's seen on the same day All investigations are done on the same day. Reports are given to him on the same day, goes back to the doctors, takes the prescription, buys generic medicine and go home in the public transport. This is the model. And the cost of these investigations are almost at par with a public hospital. In West Bengal, it is free. We have not been, many of the state governments are not able to give it free. We have to recover the cost, but we do a CT scan at 900 rupees. We do an MRI at 2,500. We do coronary angiography at 5,000 rupees. For accident and emergency patients, we have 44 ambulances which are placed in different locations in the state. These are free for people. They don't need to pay. And when they come to the hospital, 38 different types of medicines and consumables, which according to our experience are most commonly needed for emergency patients, are made available to them, to these patients, free of charge for first 24 hours. Not only that, some of these investigations, which are most frequently needed for emergency patients, including a CT scan, is given free to these people. And if they need to stay in the hospital, first 24 hours, including an ICU stay, is free for these people. Mind it, this is a private hospital. We get the money from the bank and financial institution and also private equity players. We have to return it. But don't be afraid of the fact that it might fail, where from the money will come. We do surgery, but there is no surgeon's fees, there is no OT fees. We ask them to buy the medicines and consumables, that too mostly generic. And on the profits of what we earn, that's what they spend for a surgery. For example, we are able to do a gallbladder surgery, laparoscopic surgery at 8 to 9,000 rupees. 8 to 9,000 rupees. So, distinguished delegates, my dear friends and colleagues, this is an experiment, a disruptive experiment being executed through lots of innovation in every step of our operations. And even after doing that, we are into the second year of operations. We are going to be profitable in the third year of our operations. So, doing business with the bottom of the pyramids does not mean you make losses. Needs a lot of courage, needs sense in the mindset, requires a lot of innovations in doing that. And if we all work together in this vision, I don't think healthcare can remain a distant dream for the people of India. Thank you very much.